Only 20,000 people in the United States are estimated to have hemophilia, and it is said to affect 1 in 5,000 male births. This means that about 400 babies are born with the disorder each year. Knowing about disorders and understanding what people with disorders go through daily allows us to realize how blessed we are. People, including me, take for granted how we go through our lives without having to be careful to overexert ourselves or to accidentally do something that causes our body to react in a way that it was made to. Hi, my name is Hannah Kimbrough, and my friend Caden, whom I have known for 6 years, has suffered from hemophilia his whole life. Some days he will miss school due to a bleed that causes him severe pain. I take this assignment seriously to look deeper into how this disorder really affects the body and why he must be so careful everywhere he goes. To really know what this disorder is all about, I must inform you all on what hemophilia is and how it is given to you, its symptoms, and how hemophiliac lives each day with the disorder. Some facts that speak to hemophilia and how it is diagnosed can help us better grasp the nature of this disorder. Now that I have said why this assignment is so meaningful to me, you, my audience, will learn what the disorder hemophilia does to a person and how it resides in one's body. Hemophilia is a genetic disorder in which blood does not clot normally. People with hemophilia bleed easily, and blood takes longer to clot. The rare condition is most common in males and can have life-threatening complications. This condition is genetically inherited and cannot be cured, but treated to minimize symptoms. The X chromosome is the chromosome involved in hemophilia. The X chromosome acts as the carrier for hemophilia because it is a sex-linked trait. Hemophilia is a sex-linked recessive disorder. This means that it is passed through one parent with the dominant gene, even if the other parent's dominant gene is normal. In this diagram, there is a husband and a wife. The husband does not have the hemophilia XY, but the mother is a carrier of the hemophilia gene X. This means that there is a 50% chance that the sons will have hemophilia XY, and there is also a 50% chance that the daughters will be a carrier of the hemophilia gene X. The daughters are not able to get it, but if the son does not inherit the disorder, then the girl will become the carrier of it. If that description of what the disorder is did not come as a shock, then the symptoms might give off an uneasy feeling. Symptoms are things that indicate the presence of bodily disorder and is something that indicates the existence of something else. A symptom that can happen daily is bleeding into the joints, which can cause swelling and pain in the joints, and it often affects the knees, elbows, and ankles. Another common symptom is bleeding into the skin, which is bruising, or a muscle and a soft tissue causing a buildup of blood in the area. Some other symptoms that come with the disorder are bleeding of the mouth and gums, bleeding that is hard to stop after losing a tooth, bleeding after having shots such as vaccinations, blood in the urine, and reoccurring and hard to stop nosebleeds. Yes, those symptoms do sound scary. That is one of the reasons why we should feel so blessed and so grateful when we complete our day without any of those symptoms. A quote by an anonymous person on World Hemophilia Day 2020 said, "Bleeding disorders are not the end of the world. You could still lead a normal life." I recently asked my friend Caden what he went through on a daily basis. He said, "I mean, besides being extra cautious about things like injuries, it isn't too different from what everyone else does. I have seen him struggle and be in true pain, but when he said that, I saw how strong he really is." As I had said earlier, frequency in human births. Hemophilia is said to affect 1 in 5,000 male births. So, about 400 babies are born with hemophilia each year, but we don't know the exact number of people with the disorder in the United States. Back to what I was saying. I also asked him what he does when he has a bleed. He said, "I get an infusion, which is supplying your blood with the missing factor VIII. I also take a painkiller and rest." Looking back at the quote I said earlier, I see how his response matched up with the anonymous person's quote. This proved that they do not take for granted each day of their life, and that every day is a blessing. Hemophilia is a disorder that cannot be cured, but can be minimized by seeing every day as a gift and continuing on in life. Some of the facts about hemophilia is there are 3 different types of hemophilia: hemophilia A, B, and C. The type of hemophilia that a person has is determined by the clotting factor in which the person is deficient. The more deficient the clotting factor, the more severe the person's hemophilia will be. There is no cure for hemophilia, but with treatment, people can live normal and healthy lives. Hemophilia C affects males and females equally. The disorder is usually detected early in life, with severe cases usually diagnosed within a month and mild cases within the infant's first years to 18 months. Some complications from hemophilia could include joint pain, arthritis, heart disease, kidney disease, and hemorrhaging, which is internal bleeding. Finally, now that you have some understanding of what hemophilia is and how it is given to you, its symptoms, and how a hemophiliac lives each day with the disorder, I am hoping you all have a better understanding of what it is like to live with hemophilia and realize that living with the disorder does not change the person, but does come with more difficulties in life. Thank you.